The U.S. is facing another setback in the race to vaccinate. 2 vaccination sites were shut down Thursday following several adverse reactions to the Johnson & Johnson vaccine. Despite this, more than 1 in 4 people in the U.S. have now been fully vaccinated, and more than 112 million people have received at least 1 dose. Adriana Diaz has more from Chicago.
Tonight, more roadblocks in the race to vaccinate. Troubles for Johnson & Johnson. Several patients at a mass vaccination site in North Carolina today suffered immediate reactions. On Wednesday, 11 people had adverse reactions in Denver, ranging from dizziness to nausea. Both sites temporarily shut down.
At this point, we have no reason to believe there's anything wrong with the vaccine itself. This is a temporary pause of one brand of vaccine so that we can investigate further.
This comes as distribution of the J&J vaccine will fall 85% next week, due in part to a factory mix-up. The Midwest is on the verge of a relapse, and the younger are getting sicker. In the last week, COVID hospitalizations have increased 11% on average among adults under 50 over the week prior. But in the Midwest, those hospitalizations have jumped 42%. The hardest hit state, Michigan, where today one doctor tweeted a desperate plea. "We need some help." Variants also continue to complicate the country's recovery. Of all new COVID cases last week, children accounted for roughly 1 in 5. Kids are especially susceptible to the UK variant.
Prior to this time, young kids, particularly those in 8th grade or younger, rarely got infected or seriously ill with the virus, and importantly, did not transmit the virus in the community. Today, that has been turned on its head.
The University of Chicago said more than 50 students have tested positive. Some cases were linked to fraternity parties. Tonight, a stay-at-home order. And in small-town Villa Grove, Illinois, a bar's indoor opening event was linked to 46 cases in February, spanning 8 households, leading to the hospitalization of an elderly resident and forcing a school to temporarily close, impacting 650 students.
Mask use was inconsistent, and that 6 feet of distance was not maintained. These findings underscore the vast impact of a single event.
Nationwide, nearly 5 million people have received the Johnson & Johnson vaccine. Officials say those adverse effects experienced in North Carolina are consistent with known side effects, and they reiterated that the vaccine is safe. Meanwhile, here in Illinois, the state is set to break an all-time record for single-day vaccinations. Lana?
Adriana, thank you. Dr. Dara Kass joins me now. She's an emergency room doctor and a medical contributor for Yahoo News. Dr. Kass, welcome back, and thank you for all that you do. So let's start off with part of what we heard in Adriana's reporting. Infection numbers for children have been rising exponentially, and that they seem to be especially susceptible to the variant first identified in the UK. So given all of this, how concerned should parents be right now about school reopenings?
So it's actually not schools that transmit the virus. A lot of times it's what happens around schools. So it's transmission, after school activities, after school sports. The classroom itself is very, very safe because of the distancing, because of the mask wearing, and the consistency of making sure that children follow the rules. So it's not that we're concerned about children in the school buildings. What we are concerned about is relaxing those rules around school. And what we're seeing, which is children going along with those parents that are being vaccinated and actually watching them go to gatherings, to dinners, to barbecues when they themselves are not vaccinated.
So that's a very interesting point about the importance of school and that isn't the primary point of transmission. Should parents then be concerned about after-school activities, about their children participating in sports, particularly those that are indoors?
So we are seeing a rise in cases with certain after-school activities and sports that are either indoors or unable to be masked or unable to be 6 feet apart. And what we need to do is react to the cases as they spread. So if you see an increase in cases in your community and they are linked to sports, it's up to the parents to say, maybe we need to take a break. It also, as we go into the summer, we need to realize that as adults get vaccinated and our kids are not vaccinated, we are going to have to behave a little bit differently when we're with our children than when we're not with our children. And it's going to be really hard to tell them that some of the things they're seeing grown-ups do, they really can't do the same way because they are still at risk of getting this virus.
And can you remind us when we believe that children, particularly older children in this country, are going to be able to start receiving the vaccine?
So we're optimistic that 12 to 16-year-olds should be able to, so we should see the approval process start under an executive use authorization somewhere between May, June, and into the summer, hopefully getting them start to get vaccinated in that fall. But we're not expecting the vaccine to be approved for younger children under 12, really until the late fall, winter, and even into 2022. So it's going to be a while before all school-age children are actually approved and eligible for this virus to get them all vaccinated.
Thank you for helping to clarify that. I know so many parents are concerned about their children right now. I want to ask you about another piece of major news today. A site in North Carolina paused its Johnson & Johnson vaccinations after several people reported adverse reactions. Remind us, what side effects can people expect from all three of the vaccines that are available right now? And how would we know if we're experiencing a symptom that may be cause for alarm? How concerned should we be about this Johnson & Johnson news?
So the Johnson & Johnson news itself is actually not that concerning when you go into the data, which is to say that 11 people had adverse effects and 2 went to the hospital and none had serious effects. We see a lot of the symptoms that are perceived as adverse effects, whether it's your heart rate going fast, feeling short of breath, can also be mimicked by anxiety. So we need to be able to delineate what exactly is a true allergic reaction, which is what we're most worried about, or other side effects that are expected and not dangerous at all. Things like a headache, maybe sore arms, some fatigue. Some people do get a fever. You kind of feel like you've been, hit by a truck. If you haven't, you definitely feel the effects of your, immune system revving up, and that's a good thing. I have had more questions. If I have no side effects, does that mean that the vaccine worked? Concern that it hasn't been effective, and actually, not everybody has side effects. But what we know is after that observation period, that 15 minutes, for people that have never had an allergic reaction and some for 30 if they have, most people are safe to go home and not really worry that anything that's happening to them after that is to be concerned about.
Dr. Dara Kass, thank you for helping to clarify so many of the questions that I know people across the country are asking. Appreciate it.
No problem.